Choosing the right Medicare plan is critical because you have to live with the consequences of that choice. I've been helping people make those choices now for 15 years. My company helps thousands every month to decide what plan's best for them. If I were your broker, in this video, I'm going to show you my professional advice as to who should get an Advantage plan and who should not. To begin with, when we go on Medicare, we only have two different ways in which we can use our Medicare benefits, only two. Now, there's lots of companies, lots of different names, but really only two systems for using Medicare. One of those is to stay in what we call the original Medicare A and B, which means anytime you went to a provider, a doctor, a hospital, you're going to give them your Medicare card. Medicare is going to pay first, but because of the gaps that exist in the Medicare system, those financial liabilities most people don't want, so they will buy a supplemental plan to fill in those gaps, either fully or almost in full. When we stay in this system with A and B and a supplemental plan, now we have a separate drug plan. So this is one option we have to use our Medicare benefits. The second option is called an Advantage plan or a Part C plan, also called replacement plans. So we're enrolled in A and B with an Advantage plan, but what happens here, the private health insurance company is replacing A and B, and they're going to issue one card. And so here, I go to the hospital, go to the doctor, I give them my Advantage card, and then I have an embedded prescription drug plan. And so these are the two systems that we have available to us. And the only thing they have in common is we have to be enrolled in A and B to have a supplemental plan, and we have to be enrolled in A and B to have an Advantage plan. But beyond that, they're two totally different systems. So those of you that are considering C plans, Advantage plans, there are some that should, and there's some that should not. So let's review. Hey, just real quick, we often hear from our viewers that they wish that they would have seen a video earlier because they made a decision that really wasn't in their best interest, or they made a decision without having this information and it cost them financially. And we don't want that to happen to you. We upload 3 times every week, and the only way you're going to know about our new videos is if you subscribe to the channel and hit the bell notification. We're constantly giving away brand new strategies, updates, and comparisons that you don't want to miss. So click the subscribe button below this video right now and turn on notifications so that you never miss another video. Now, in order for someone to decide that an Advantage plan is going to be best for them, I believe it's these conditions that must be met. Number one, you should be in a location where Advantage plans are favorable. And there are some parts of the country like that, certainly in Los Angeles and Florida and Las Vegas and New York and other places around. But you have to be in an area where you're in a really populated area, a very large metro area, because the larger the area, the more competition there is, the more Advantage plan options, which is going to drive down some of those financial out-of-pocket costs, your max out-of-pockets, and those kind of features. And so location really does matter. There are some parts of the country that Advantage plans are terrible. They're just not attractive. We can't get enough doctors and hospitals to be in the network. And so you want to make sure, first off, that you're in an area that you know for sure that Advantage plans are favorable in your area. So that's number one. The second condition would be your monthly budget. In other words, there are some people that should definitely get an Advantage plan because their monthly budget is just so tight. I mean, extremely tight. Now listen, I know if you're retired, you probably would feel like your budget's tight anyways, but I mean extremely tight. This means that even enrolling into Medicare A and B, you've got that B premium this year, $164.90, and I have people say, this can be very difficult for me just to take that out of my Social Security check. Okay, well, if your budget's that tight where Part B is going to be a challenge for you, number one, I would apply for extra help. You may be able to get some help with the Part B, but again, that's probably for you, an Advantage plan is going to be best because you just can't add anything else to your monthly fixed expenses. So location, monthly budget, extremely tight. And then number 3 here, you must understand the features. I know that Advantage plans are advertised, and they always advertise kind of the highlights of the plan, some of the great features of the plans, but sometimes people don't really understand how an Advantage plan is going to work. So if I'm your broker, I'm going to make sure that you really do understand how Advantage plans work. There's features of them that are critical for you to grasp. Well, let's look at those features. Number one, an Advantage plan is a pay-as-you-go system. Now remember, if I have an Advantage plan, I've got to be enrolled in A and B. A is free for most people. B has a premium this year of $164.90 a month. So you have to be enrolled in B to have an Advantage plan. You got to live in that plan's service area or the metro area to qualify for that Advantage plan. But beyond the B premium, most of the Advantage companies do not charge anything to be on that plan. In other words, there's zero premium plans. And so instead of paying a premium, you're going to pay as you go. Now, there will be a few items on every Advantage plan where it'll be a zero copay, usually to see a primary care doctor, maybe to get some basic labs, a gym membership thrown in there at zero cost. So there's going to be a few items that are going to be zero, but the majority of healthcare services you're going to get are not going to be zero. There's going to be a very reasonable copay. For instance, if you go to a specialist, it's going to cost you anywhere from $25 to $50 per visit. So that would be your cardiologist, your orthopedic doctor, your dermatologist. You'll typically pay a reasonable copay. If you go to the hospital, it's not going to be free. Pay as you go, it's going to be anywhere from about $300 to maybe $350 a day, each hospitalization, up to a certain limit. Some plans stop after 5 days, some after 6. So if I'm in longer than 5 or 6 days, then there's a zero out of pocket to me. But I pay a daily copay till I hit that limit each hospitalization. Again, $300 to $350 per day. If you have an MRI or a CAT scan, that is not going to be free. And again, it's pay as you go. And that's going to range anywhere from $150 to maybe $250 for an MRI, a CAT scan, or maybe a PET scan. If you have an outpatient procedure, such as a knee replacement or maybe cataract surgery, again, somewhere between $250 to $400 copay out of your pocket. So as you can see, it's a pay-as-you-go system. Zero premium to the insurance company, but I pay as I go. So I'm just basically taking on the risk of whatever healthcare services I'm going to need for that year. Now, the second feature you have to be comfortable with is what we call the max out-of-pocket, acronym max out-of-pocket. So every plan, you have a schedule of copays for most services, and all those copays are being applied to your annual max out-of-pocket. So that's basically the risk that you're taking on. And again, it's going to vary throughout the country, but it's going to be somewhere between about $3,000 to about $7,000 on an annual basis. So that would be a MOOP. So what that means is these copays that I have for some of my healthcare services is being applied to that $3,000 to $7,000. And once I reach that, then you can put your checkbook away, your wallet away, because there's no additional out-of-pocket expense medically once we've hit the max for the year. And then those max out-of-pockets reset every January, and then I start the process again, and I'm going to pay my copays until I hit that max. So the point is, you've got to be comfortable with the risk of that max out-of-pocket. I didn't pay a premium, which we like, but I'm still going to pay. And so you have to be comfortable knowing that if I did have cancer or some serious health issue that's going to happen, probably going to hit the max, and you have to have some place to get that money. All right. The third feature we got to be comfortable with is the fact that they're one-year plans only. Advantage plans are written for 1 calendar year. So if you start July 1 on Medicare, that's going to be your plan for 6 months. Okay. And so it's a one-year plan. Basically, it's a one-year agreement between Medicare, the insurance company, and you. And so that's why every year we have this Medicare open enrollment period. And those dates are October 15th through December the 7th. And this is a time in which people can switch their Advantage plan. So if I'm unhappy with my plan, maybe the doctor's no longer in the network, or they raised the max out of pocket, or something's happened on the plan I'm just dissatisfied with, then I can switch my plan October 15th to December 7th, and that new plan will kick in January 1. Why? Because all Advantage plans are only written for 1 calendar year. You've got to be comfortable with that. The fourth feature would be the fact that you are absolutely going to have a network of providers on an Advantage plan. And there's only 2 types of networks. Those are called HMOs, or those are called PPOs. And so when you select an Advantage plan, you're also selecting a network. Now, these networks are a little bit different. Number one, in size. There will be more providers on the PPOs than the HMOs. The HMOs are attractive to you, the consumer, because typically we have lower copays and lower max out of pockets, and sometimes some additional benefits they would put on the HMO. But the restriction is you're not going to have as many providers to see. Now, that does not mean to say there's not plenty to see. It just means there will be less on the HMO network than the PPO. Now, the PPO network is attractive to some people because, again, more providers to choose from. And then also on a PPO, you can go out of your network. If you have an HMO plan, you are confined to that network unless it's an urgent care situation or emergency room. Anywhere in the world, actually, you can go. But the HMO says if you're beyond an urgent care or emergency room, you have to stay in their network of providers. PPO allows you to go out. Now, if I'm on a PPO and I choose to go out of my network, it's going to cost me more. My max out of pocket on the PPO in network may be $5,000 a year, out of network could be $10,000 a year, but I do have the privilege on that PPO to go out of the network. So the whole point is when you have an Advantage plan, you have networks, which means you have limitations of providers and some restrictions. Sometimes an HMO plan will require that you get a referral from your primary care doctor before you can see a specialist, and there's things like that that happen with Advantage plans that you have to be familiar with and of course comfortable with as well. Now, number 5 would be the embedded drug plan. And so when we get on an Advantage plan, we call these plans when they include prescription drugs in MAPD. So the Medicare Advantage portion would be my inpatient and outpatient healthcare services. But for the medications that I self-administer, your cholesterol, your high blood pressure, maybe your insulin or whatever you're taking, that's going to come through your prescription drug plan. It's a Part D plan that's actually included with this. And so that's why we're saying it's embedded. In other words, you enroll in the Advantage plan, then they have pre-selected a prescription drug plan for you. You didn't select it, it's just part of the package. And frankly, sometimes they're very good and sometimes they're mediocre. So when we go on Advantage plan, we have to be very comfortable knowing that my meds are going to be well covered by that prescription drug plan that's embedded as part of the package. All right. And so then number 6, and that would be this, you have to be familiar with this feature called a pre-authorization. Now, what a pre-authorization simply means is this. This means that you need some type of a healthcare service and your doctor has said you need a CAT scan, MRI, you need a hip replacement, a knee replacement, or you need a surgery inpatient. But the doctor said you need something. When you're on an Advantage plan, what has to happen is that Advantage plan has the pre-approval right. They have this authorization to have to agree with what the doctor's recommending. So doc says you need this, and they'll actually submit the pre-approval, pre-authorization to the Advantage company, and they'll review it. And they're going to get back with a decision. They're going to say, yes, we agree with that, we will pay for that, or no, we don't agree with that, and we're not going to pay for that. In other words, we're just not going to cover that service. And so that's a pre-authorization. And I can assure you, anything that's going to be on the more expensive side is going to have to be pre-approved. Now, you can see your primary care doctor without one of those. There's no pre-authorization. Basic lab work. There's lots of things that you're going to be able to go see a specialist without having a pre-authorization. But if it's expensive, any kind of a scan, any kind of a scheduled hospital stay, outpatient surgery, outpatient procedure, any of those things are going to have to be pre-approved. So my point is, the doctor says you need this, but the doctor doesn't have the final say-so when there's a pre-authorization. The insurance company has the final say-so. And again, sometimes they will give immediate approval, but sometimes they don't. I've had situations when someone needed a knee replacement. Doctor said we need a knee replacement, and plan said no, we want to go with meds first. We want to go with steroid injections in the knee for a while. I had a lady who needed a hip replacement. Plan said no, we want 9 months of therapy first. I had a lady recently need a hip replacement, and the plan said no, we will pay for a rod only. We believe that's sufficient, and that's all she got. And so when you get on an Advantage plan, we have to make sure that we're comfortable knowing that we are going to have some pre-authorizations that we have to deal with. And then lastly, when you get on an Advantage plan and you want to move Advantage plans, we know that we can switch Advantage plans October 15th through December the 7th. That happens. We also have another period of time where we can go Advantage to Advantage plans, and that is any time between January 1 to March 31st every year. This is called a Medicare OEP. Open enrollment period, okay? This was called the Medicare AEP, annual election period. So we have the first 3 months. If I'm on Advantage plan January 1, I have the first 3 months where I can switch to another Advantage plan, and there's no underwriting required whatsoever. So switching Advantage plans, frankly, is very easy. But here's the issue. If a person's on an Advantage plan and they would like to switch now to a supplemental plan, in other words, they decide, I don't like these features. I'd like to be on that supplemental plan. Here's the way it works. Let me give an example. Let's say that someone starts with Advantage plan at 65, meaning they're new to Medicare, they enroll in Medicare A and B, and they have an Advantage plan. The very first 12 months in that scenario is called the trial right. And so the first 12 months, first on Medicare, select an Advantage plan. Anytime, any reason during that 12 months, I can move off my Advantage plan and I can get a supplemental plan, that F plan, G D plan, N plan, or whatever plan you decide, and there's no underwriting required whatsoever during that trial that first year of being on the Advantage plan. But after that 1 year, meaning 1 year and 1 day into the future, 2, 3, 4, 5 years later, if I'm on Advantage plan, now I want to switch to a supplemental plan, it is not going to be automatic in 46 of the 50 states. Okay, there are 4 states where you actually can move from Advantage to a supplemental plan, no underwriting. That would be New York, Massachusetts, Connecticut, and Vermont. Okay, if you're in those 4 states, you can do this, no underwriting. The other 46 states, you're going to go through an underwriting process. So if I want to switch to a supplemental plan now, we're going to have to ask you 25 or 30 health questions. We're going to check all your medications that you take right now and have for the last 24 months or in the 24 months prior. And then we may need to get a statement from your doctor as to your health condition. And so the point is we have this process we have to go through called medical underwriting. So when we submit that application to the supplemental company, if they don't like your pre-existing condition, they don't have to approve your policy. If you're taking medications they're uncomfortable with, anything going on in your health records, they can say, no, we're not going to approve that application. Now, keep this in mind. When I do start on Medicare and I get a supplemental plan, the first 6 months on Medicare, the supplemental companies have to take you. But beyond that, they don't have to. And so again, if I stay on that Advantage plan 1 year and 1 day or into the future, now I got to go through the process of medical underwriting. And so there are things that they just simply will not approve. Today, if you have rheumatoid arthritis, very difficult to get you a Medicare supplemental plan. Spinal stenosis, if you've had AFib in your health record, even one incident, you're not going to get approved. Sometimes insulin-dependent diabetics, very difficult to get you on a supplemental plan if we have to go through underwriting, especially if you've had retinopathy or neuropathy or any kind of complications due to diabetes. And so the point is that insurance company, supplemental company, has every right to say, no, we're not going to approve the case. They're not required to take your pre-existing conditions at all. And so again, we have to go through that process. So when you take an Advantage plan, we have to make sure that we're comfortable with the feature that it could be a permanent decision. If your health has changed, you'll never get off that Advantage plan.
Hey, my name's Josh Musick, and if you've been enjoying my dad Marvin Musick's content, you really need to go to our website, medicareschool.com. When you go there, you'll be given the opportunity to download a free 1-hour Medicare Essentials workshop, and it's going to take you all the way from Medicare A to Z. By the time you're done watching that workshop, you're going to know how to enroll in Medicare, when to enroll in Medicare. You're going to know the differences between Advantage plans, supplemental plans. You're going to know how to get drug coverage. You're going to know everything you need to know to get the best coverage possible. So go ahead, go to medicareschool.com and watch the Medicare Essentials workshop.
Okay, so number one, if I'm your broker and advising you what to do, who should and who shouldn't get an Advantage plan, number one, we want to make sure that you are in a location where Advantage plans are very favorable, a lot of competition, and sizable networks. Number two, we have to make sure that you just know for sure that the only way you can do this is to have a zero premium Advantage plan and you're willing to take the risk and do as a pay-as-you-go, and of course all those features that we just reviewed. All right, so those are the people that absolutely should look seriously at an Advantage plan. Okay, now, so that was this option here. Now those of you that do not like some of those things that I talked about, then again, you may want to stay over in this system, okay? And again, so what are we saying? We're saying here you're saying, I don't want to pay as I go, because when you get a supplemental plan, what happened? It is not a pay-as-you-go system, folks. You actually pay a monthly premium, and you're going to pay that monthly premium. Most people today are getting a G plan, and then you have to add a prescription drug plan. You got a premium for that as well. All right, and so again, you're willing to say, I'd rather pay a premium and not have the risk as pay as I go. I'd rather just go ahead and pay and get very few bills, no surprises whatsoever. I don't have to worry about that annual max out of pocket, because over in this scenario, your annual max out of pocket would be your premium. I'll just give you a quick example. And again, we're a nationwide company, so please, when I'm getting ready to share with you rates, some are going to be higher, some are going to be lower. But on the average right now, most people are paying about $125 a month for a supplemental plan G, which is what? That's about $1,500 in the year. A drug plan on the average right now is about $25. So again, what is that? That's about $300 a year for the Part D plan. So what have we done? We have just taken on the premium of about $1,800. If you have a G plan, you have a small deductible, that's $226. So if you take that $1,800 for the whole year, the $226, we're just a little bit above $2,000 that we'd pay, and we're pretty well done. with out-of-pocket expenses, all right? If I have a Medicare Advantage plan, we looked at the max out-of-pockets. What were they? Somewhere between about $3,000 to $7,000. And so some people say, well, I'd rather not have the risk of that max out-of-pocket. I just soon pay a premium and be done. But again, that's what you have to decide. How do you want to pay for this? So when we talk about the risk of MOOPs for Advantage plan, $3,000 to $7,000, what's our risk whenever we talk about a supplemental plan? Again, that's $1,800 for the year out of pocket plus my small B deductible. So again, about $2,000. And so again, as someone that doesn't want that can do a supplemental plan and not have the risk of that $3,000 to $7,000 a year. Now, Advantage plans are 1 year. Supplemental plans are written for life. Advantage plans have to be renewed. The plans come and go. They can have a change of networks. Doctors come and go. They can pull the plan if they want the next year, but that's not the way it works with supplemental plans. So Advantage plans 1 year. Supplemental plans will be written for life. Once you've been approved, they issue the policy, it's yours for life. You can move away, move from one state to another, take it with you. They can never change the terms other than just the premium. If you get a G plan, you're only responsible for a B deductible once a year. That can never be changed. And so that's one of the beauties of these plans. They're totally portable. They can't cancel a supplemental plan other than non-payment of premium. Pay your premium and you truly have that for the rest of your life. Just like A and B is for life, that supplemental plan can also be for life. Not so with the Advantage plan. All right, so those who would like lifetime plan, again, that's supplemental. Another thing when it comes to networks, again, Advantage plans, remember they had the HMOs and PPOs. If you have a supplemental plan, you can go to any provider as long as that provider takes Medicare. That's the question you have to ask them. Do you take Medicare? And the great majority of providers do. The Advantage plan, that provider has to elect whether they want to be in the HMO or the PPO or both or none. There's some doctors who don't take any Advantage plans. But as long as that doctor takes original Medicare, they will take that supplemental plan of choice. F plan, G plan, N plan, whatever company you want to go with, they have to take it because that's nothing more than the secondary payer and you have the right to choose whoever you want in that regard. Okay, so those who like supplemental plans also, we don't have an embedded drug plan. That's not part of the package. Why? Because what we have, when we have a drug plan, we have what's called a standalone plan. And again, remember that there's that separate premium, about $300 a year, average about $25. So I've got to pay for that, but I selected that. I selected that plan based upon the medications I take and the pharmacy that I want to go to, okay? The supplemental plan does not include that. They don't select that like the Advantage company does. You get to select that. And again, in most zip codes, we have anywhere from 15 to 25 different plans to choose from. And the good news is they are written for 1 year at a time. So if next year I need a better drug plan or I need less of a drug plan, then I can switch those drug plans during the Medicare open enrollment season, October 15th through December 7th. New drug plan kicks in January 1. Okay, so again, that's going to be a difference. And then when it comes to pre-authorizations, Advantage plans have them on about 72% of all services needed on Advantage plan have to be pre-approved by the insurance company, which means your doctor, frankly, does not have the final say-so. Not so whenever it comes to a supplemental plan. We never have a pre-authorization. If your doctor says you need it, Medicare says they'll cover it, end of story. That supplemental company has no say-so whatsoever. Medicare pays, then the supplemental plan has to pay based upon the supplemental plan that you bought. Okay, so there's no pre-authorizations in that system whatsoever. And then lastly, when it comes to switching plans, if I have a supplemental plan and I want to move to another supplemental plan, in about 40 of the 50 states, in order to make that switch, remember after that first 6 months of being on Medicare, now we have to medically qualify. About 10 of the 50 states, 10 of the 50, have some certain rules. Actually, 4 of them, you can switch anytime. 6 of them, they'll allow you to do that around your birthday, around the policy effective date called the anniversary date. But my whole point is moving supplemental plans, which most people don't do anyways, but if we're going to, so what we're looking at is to make sure that we're going with a company that has stable rates, all right? And so the point is supplemental plan to supplemental plan can happen, but typically we have to go through underwriting. So again, we select the right company that's going to provide for us the best long-term coverage. Alrighty, and now also keep in mind, if you're on a supplemental plan and you want to go to an Advantage plan, you can do that anytime you want during the Medicare open enrollment, October 15th through December 7th, and that Advantage plan would kick in January 1. Again, no underwriting. All right, and so the whole point is this. When we make this decision, we want to make sure that we understand what we're getting. And there's those of you who should absolutely get that Advantage plan. location, your budget's extremely tight, and you're comfortable with the features that we went over. And for those of you that can afford a little extra, really to have premium insurance and not have to live with some of those features on the Advantage plan, then again, you probably are going to want to go with a supplemental company. And we just want to make sure that we're going with the right one that's offering to us stable rates.